Hello and welcome to Life Unrestricted. I'm your host, Dr. Al Cobb. I'm a board-certified chiropractor and concussion rehab enthusiast in Lubbock, Texas. This podcast is devoted to helping you explore life and health in all of its many facets so that you can live a life that's truly unrestricted. Thank you, everybody, for tuning in to another episode of Life Unrestricted. I'm your host, Al Cobb. Today, I have a really special guest with me. This is Janda Bishop. She is an occupational therapist. And I'll just go ahead and let you take off. How did, give a little background on yourself. How'd you get into OT? Some of your years taking care of TBIs and all the other stuff that's kind of wrapped up in that.
Okay, sure. So I became a therapist about 20 years ago. I came to school at Tech and I really thought I was going to pick a totally different pathway, and I decided to volunteer at the hospital.
It's crazy to let you be a therapist at 12 years old. That's crazy.
Thanks. He really doesn't know how old I am. No, so I went to the hospital and I thought, I'm going to follow around a couple of therapists. One of my friend's moms said, I really think you would be a great therapist. Are you sure you want to do political science as your background? And I said, well, I don't know, maybe not. And so I went to the hospital and I worked in the burn unit and I worked in inpatient rehab and I volunteered there for 6 months. And then I literally changed my entire focus from having, going to school to do English and political science to biology. My parents about lost their minds because they were like, are you really doing this your junior year? And I did. And then I loved my experience there. And so I applied to OT school and I got in. And so my entire career, I started out getting to be at UMC at the hospital that's here in our town as a student. And then they didn't have a job for me when I left. So I did long-term care for a little bit. And then they called me and said, hey, do you want to come back to the hospital? And I was overjoyed because I was going to get to be in an inpatient rehab. And that's kind of where it all started, where I really found my love for anything neuro, whether it's TBI or stroke, just anything that's neuro related. I had some great mentors and they made me just fall in love with it.
Yeah.
And so that's where I started seeing the majority of my patients.
And the neurological world of any rehab, I mean, even chiropractic or PT, whatever it might be, is probably my favorite as well. It's just, I think it takes out the mundane aspects of a normal day. You're not just in the chiropractic world, you're not just cracking backs or oh, I saw you last week. All right, well, let's see you next week. And you can continue that for 5 years. It's there's something to it that is, it draws something out of you because you have to be super intentional with the care that you provide. And there's always some complexity to it.
And I think that's what makes it, it's very challenging.
Yeah.
But it also makes you want to dive deeper into why is this happening?
Yes.
And so I think that's why because in school, oh goodness, my neurology class was not my most favorite class. I am not going to lie. But I remember once I got into that space and seeing all of those TBIs in inpatient rehab, and then my inpatient rehab day shifted to an outpatient clinic and seeing them there, I just fell in love with it. And then I was like, okay, I want to what's the next thing? What can I do next? And this is before a lot of technology. So it is getting out your books and reading things and researching them. And then just kind of listening to those families and what their lives look like prior to their injury or their accident and what was important to them and really trying to make that a part of their life again. And so I think that's also the beauty of being an OT. You get to really figure out what is important to someone, and then you just really act on that. And it may look different for them, but also you can also kind of add what they loved back into how their life is now, now that they've had a head injury.
Yeah. Somebody asked me recently, they were like, what is an occupational therapist? And I was like, I know what they do. But
that's funny.
Yeah.
Yes. We get that all the time. Are you going to teach me a new occupation? That is what everyone says. I think that's what everyone says. If you look on the computer and you look it up, no, we are not, I guess in sense, we are trying to help you with maybe whatever occupation you had prior to your injury. But no, I'm not trying to find you a new job. I am trying to work on all of those skills that you
Mhm.
need to carry out what your job was, maybe before you had your accident or your illness or your injury, or but I'm not getting you a new job.
Right.
So we focus on lots of things. So I think the biggest thing is if you hear occupational therapists work on ADLs, activities of daily living. So when you think about if you're laying in your bed in the morning and you get up, what are all of those things that you do prior to starting your job? Those are the kind of skills that we work on. So getting dressed, taking a shower, going to the bathroom, putting your makeup on, putting your contacts in. I meant all of that stuff. But then there's so much more to that. Then there's the cognitive aspect of that. And what do you need? Like, what are the steps that your brain has to go through to be able to complete all those tasks? And if you're not able to complete those tasks, what are you going to do to adapt to now be able to do that independently? And so I think that I'm trying to talk more like what I would do, like from a TBI standpoint, but there's lots of other things that OTs do as well. I think that those are the biggest things. Because then if you look at the neuro side of it, all of the sensory part of it, the sensory integration part of it, that's really important in how you regulate after a TBI.
Yeah, absolutely.
Because you're more than likely, things are different. You could have a different personality.
Yeah.
And so I think that's kind of some of the things that OT touch on.
Yeah, that's awesome. So yeah, let's dig into that a little bit.
Okay.
Talk about so your years being spent in taking care of hands-on, taking care of people that were experiencing neurological problems, either from a traumatic brain injury or a stroke or some other related problem. So talk a little bit about um, what that usually presented with, and what are some things that most people would be surprised that you're looking at, you know?
Okay. So, I think about my time like in inpatient rehab. I saw people who had sustained a TBI because of a skiing accident, because of a car accident, because then we had lots of strokes, people who had strokes, young and old. So, I think that that's kind of where my passion for all things, like even pediatrics to adults, kind of started.
Yeah.
And so, it obviously everything always starts with like an initial assessment and kind of seeing how they're doing. An OT, they have standardized tests that we follow. So you have, if they're still not like awake, you have like a Glasgow coma scale. So different standardized tests. So back in that time, we would look at those tests to kind of help us determine what was going on. But I think the other thing is we would talk to their families. We would talk to their loved ones. We would talk to the people that were involved in their life and say, what did they love to do? What was something that they enjoyed doing? What did they find passion in? And then, I had one lady in particular that her job was she loved to make tortillas for her family. And she couldn't do that anymore. And so we literally went and got her recipe and practiced making her tortillas in a way that she could do it. And it looked different. And she was frustrated. And we were just excited because we were going to get homemade tortillas. But I think that's also the cognitive part of an OT. We got to really work on that along with all the other disciplines with PT and speech to help her carry out what her goal was. And so I think that that's the part of the cognitive aspect of a TBI. And then you talk about the neuro stuff. Is her arm not working right because of this injury? Now, was she right-handed, but she's going to be left-handed? What did that look like? And for me, I got really good learning how to do things left-handed. I am so right-brained that I was like, if I'm going to be telling these people, let's use your left hand, I better for sure know how to do it myself. So that's where I got to be able to like tie my shoe left-handed, brush my teeth left-handed. I didn't wear contacts. I had to learn how to put contacts in. So different things like that. I think that was that's the neuro side of it. And then the sensory side of it. Just and the regulation part of that and what that looks like. You sometimes after a head injury, a stroke, you're not the same person. You're more agitated. You're frustrated. You say things that you might not say at all, and they can be hurtful. And then the family is sad because they're like, what is their life going to look like? This is not anything how they were before. And so I think that we had to learn how to work around that too. And just reassure the patient, first of all, but to reassure their family, you know what, this may look different, but we're going to try to do our very best to teach them all the skills that they need to be able to go back to what they were doing before, whether that be a student or working in the workforce, whether that be a mom taking care of a baby. So I think that was another great, exciting thing that I got to see, is a head injury who was expecting a baby.
Whoa.
And then what that looked like. And so having to diaper your newborn baby, how to feed your baby, what does that look like? And so I think that that part of my job was interesting to see too. And it made me feel different when I became when I became a mom, and what we take for granted. I think that's the moral of the story, is we take so many things for granted, and life is so short.
Absolutely.
And so really just teaching them what they need to be successful. But to also just feel, it's like, I think, say this, and you're going to hear this with any therapist, it's really client-centered. What is important to your client?
It should be that way, at least.
Yes, it should be that way, at least. And so
that's awesome.
I love that part of it.
Yeah. So obviously, brain injuries exist on the spectrum, ranging from moderate or mild to, which is what we would call a concussion, or some type of, I don't know, you saw stars, whatever you want to say, ranging to moderate, which is you're getting more into actual damage to the brain, which, not that concussion isn't damage to the brain, but now we're talking more physical trauma that you can see on an MRI or some type of CT scan, to severe, to where those activities of daily living are severely diminished. Maybe they need a 24/7 support in the home, whatever it might be. And I think that what you're expressing is that there is a really big need to be able to have a personalized care for that situation. And a lot of times it's going to happen in the hospital or in some type of outpatient care setting. But I think that's great. Is there anything that kind of surprised you about taking care of people with traumatic brain injuries that maybe you didn't expect? Because when I was hearing that, I was like, dang, I didn't even think about, like, maybe their personality changed, or their mood changed, or obviously the mood will change, but now you've got to learn how to interact with people again, or brushing your teeth with another hand. Like, that is something I did not even consider. But
yeah, I mean, I think that probably what surprised me the most, and this was like 18 years ago, and I probably won't ever forget it, is a really young girl, and she had a really bad car accident and sustained a really bad head injury. And I walk into her room, and she's like in a netted bed, because she's trying to pull all her lines out, and she's so combative, and she's so upset, and she was so confused, and she didn't know where she was. And then her family didn't understand what that looked like either, and so they would just end up leaving her in there, because they didn't know what to do. So I think that that's where a therapist then also becomes a counselor, then also tries to teach the family, like, it's okay to go in there. Her life might look different right now, but she needs you. She needs that emotional support. So I think that therapists also teach that side of it too. Like, we don't know going in there that we're like, okay, we're going to assess the disability, but there's also that emotional side too. And that cognitive component for the family now, because they have to shift their way of thinking. And I remember her being in there, and she was so alone. She had no one, because they didn't know what to do. And I remember saying, it's going to be fine. It's going to be fine. And I was young. And she's like, it's going to be fine. And you're going to be okay. And I meant, she is screaming and crying. And I'm like, we've got to get her out of this bed. And just how, like, traumatic that looked. And we got her out of the bed, and I thought, oh, perfect. We've got her out of the bed. And then she just, she falls on the floor and just is so upset. And so then I think, like, I had to completely shift, like, okay, we're going to get dressed. We're going to work on all these OT skills. But now I've got to deal with how she's upset, and what are we going to do to calm her down? So that's the regulation part of it. But then also we've got to put some things in place for her family. To be like, this is what her life is looking like right now. These are the next steps that you're going to take. And what are we going to do to help her be successful, but to help her family understand what's going on? That's the beauty of a support group. That's the beauty of nonprofit organizations, that supply all of these families with the resources that they need, because then they share them with us, and then we're able to carry that out as well.
Yeah.
So,
yeah. For the listeners, the last episode that you would have heard, hopefully, if you haven't heard it, go back and listen to it, is with Tim Siegel. And Tim had a son named Luke who has changed the trajectory of that whole family. He unfortunately passed in 21, but Luke's legacy is Luke's legacy is moving forward in the form of a nonprofit that is actually providing those resources financially and education wise. And did you know they actually released a documentary recently?
I did.
Yeah, so,
I did.
yeah.
Just because that story is close to our town.
Yeah, to the whole town, and then
it's close to our profession, and that family. It's been life changing for them, but that organization has supported the therapy community and kids and adults well.
Yeah, absolutely.
I mean, to the point where they have been able to get, funding for things that some families wouldn't be able to get. And so as a therapist, we're super thankful that they're so supportive of what we do as well.
Yeah, likewise. Anything else involved in the initial or the hands-on care for people that have had some type of neurological setback?
So I think that the biggest thing is that sometimes then after all of this, we have to think about them returning to work or returning to a different job. So I think that's also was a part of our job. I meant not just I did inpatient rehab, and then I also did outpatient rehab, and then I went to home health. But I also think that kind of in between those from the hospital to an outpatient, and then from outpatient to home health, we had to decide, okay, they're getting ready. They now are maybe ready to go back to a job, because not every situation looks the same. And so some of those individuals, some of those patients, we were like, what is the next step? Are you going back to being a school teacher? Are you going back to being a kid in 5th grade? And so what that looks like, and giving them those resources, like what kind of things do we need to do to get you back into the workforce or back into the community. So an OT also works on that. And kind of the beauty of an outpatient and home health, you sometimes are able to get to practice that actually in the setting. You're actually able to go to work. So I had a lady that I actually got to go on the job. She worked for Southwest Airlines, and I got to go to her job to help her practice going back to her job and what that looked like. And the neat part of that story is I saw her probably 2 years ago. And that happened to me like 18 years ago. But to see that she was able to go back to what she did, and she was thriving and doing wonderful. And so I think we also get to see that side of it.
Yeah.
We get to see like, okay, this is what happened. You actually get to go back to your job. It may look a little different, and we may have to put some things in place to help you be successful, but you made it.
That's
and
amazing.
You're successful. So I love that story.
Yeah, absolutely. So as far as your career has gone, you've had kind of a shift in the last, I don't know how many years, but I think I'd love to hear a little bit about what you're doing now and how that's kind of shifted throughout your career as well.
For sure. So I've kind of had a wide range of things.
Yeah.
Which I'm super excited that I've been able to do all of it. Like I love that I've been able to work in a hospital and to be in an outpatient setting, to be in home health, and now I get to be like doing private practice. And I think that's fun that I've been able to see all of those things. I also think it's kind of shaped who I am and what I find passion for today. So my oldest daughter struggled with a neurological injury from seizures as a baby. And so that further enhanced what I do made a lot more sense. I loved what I did, but then when she needed all of these therapies and all of these things, it helped me kind of understand, okay, this is what it looks like in the life of a mom that is also a therapist, which can kind of be hard sometimes because you think you have it figured out and you don't. But then to now where I'm doing private practice, so I'm doing something kind of totally different.
Yeah.
So I'm doing a lot of cranial sacral myofunctional therapy, and that's something that I didn't learn in school. That is something that now I think they're starting to talk about in school, which is exciting. but I was able to, partner with one of my dear friends, and we get to work together and get to see those kind of results paired with our traditional occupational therapy, which has been amazing because we still get to do what we love.
Yeah.
But we also get to see adding this into what we already knew and to just see the progress that these patients are making quickly.
Yes.
And so I've been able to also take those skills and do them with my daughter as well, and to see what progress she has made. And I think that's kind of the shift that I'm taking right now.
Yeah.
And so that part has been fun to watch, and fun to also try to, learn the business side of being a therapist.
Oh my gosh.
So now I can add that to the list.
That's a whole other world.
That's a whole other world. That's a whole other world.
You're going to have like an MBA from the School of Hard Knocks by the end of it.
Yes, absolutely. Or become a tax attorney. I don't know, one of the two.
You might end up back in politics.
Yeah, maybe so.
That's awesome. So, what are the so mainly, correct me if I'm wrong, it's mainly pediatrics now, or is it more across the spectrum still?
So it is still across the spectrum, which is great. I love that. I would say that probably 50% of it is pediatrics, but then maybe 75% is pediatrics. So maybe 25% adults, but I still get to see some stroke patients, which I love. We got to see some chronic pain patients. We see actually some head injury patients. Yeah. So I think that it's kind of a little mix of both, which is fun.
And I think the benefit to having that, which maybe it is a little bit more complex on the patient side, but they know that when they come in here, they're working with you. And when they call the office, they're going to work with you. And it's more of what we got into this for, to be able to just take care of patients.
Yes. I explained this to one of my moms the other day. I said, I don't know if you know this, and maybe you know this and maybe you don't know this, but really what I want my career to be is that I've just taken really good care of you, and that you have gotten good care while you're under my care. Yeah. And that you hopefully find and see the passion that I have for what I do. And that saying, like, if you, what is it? If you'll never work a day in your life if you do what you love, or if you do what you love, you'll never work a day in your life. I love that because I still love what I do. Yeah. There are days that I get up and yes, are you tired? But I really still enjoy doing what I do every day. And that's what I tell my kids. Find something that you love to do every day. And if you do it, then you're going to be excited to go to work every day. Yeah, absolutely. So that's what I want. That's what I hope that people can see in me, is that I love what I do and that they get good care here. And if I can't provide that care, that I'm able to find the people that I know that can help them out as well.
Likewise.
And so I think that it takes a whole discipline and a whole team approach for people to make progress. Yes. And that is the beauty of, it's the beauty of Lubbock and the beauty of like a small town, and just how friendly the people are here, that we can have these kind of conversations and be like, I don't know why this is happening. Do you think you could take a look at them? So I like that part of it.
Yes. It's been awesome to see that and be a part of that conversation as well. Because you and I and myself with other providers in the area will text or call each other like, hey, I've got blank. Do you think that could be potentially something going on with their airway or with their jaw or with their tongue posture? And so, and vice versa. So I think that it's even more to the benefit of the patients that we see, because
it is.
Then we're able to not just get good care in the clinic that you're being personally seen in primarily, but also then you're opened up to a network of providers, because the people that we know all care about their patients, not just as a dollar sign, but as somebody that has a real problem and we get to take care of. So it's awesome to be able to have you in our community.
Well, likewise.
Yeah.
It's good.
So we'll wrap it up here. Any last things to leave the audience with, to think through when it comes to caring for people that have had some type of neurological complaint?
I mean, I think the biggest thing is to just really listen to the patient. That may look different. They may not, be able to talk, but to just think about what their passion was prior to their injury or their illness, and really honing in on what's important to them. And then you as a practitioner just being able to get in to take out all the resources that you have to treat them. And then if that's not working, to be like, okay, let's try these things, just because our ultimate goal is for them to feel good and for them to get back to what they were doing. But at the same time, it's like I told that patient's family, like, we want you to get good care here. Like, we want you to feel like we have done everything that we know within our skill set to help you. And I think that's kind of what this is about, is just educating people on, okay, this is an option for you. This is what they have here. Let's try these things to see if you can get better.
Yeah.
And so then I think just wrapping up and talking about all the other things that therapists can do, we can add that to our next conversation.
Yeah, absolutely.
Yeah.
And how can people learn more about you if they have something that is of interest to them as a potential patient? How can people reach out to you or find you?
Yes. So you and I just had this conversation that I grew up in the non-EMR, all of that.
Yeah.
Really, I haven't even started social media yet. And I need to be doing that. But I do have a website, Restore Occupational Therapy. And you can find me there. You can Google my name, Janda Bishop. It will come up as well. And then maybe eventually I will get better and do the Instagram thing.
Yes.
Or let my kids set it up. Maybe that's what I need to do.
That's
let my kids set it up and let them go do it so I can get in the social media world.
Awesome.
So, yes.
And particularly if there are, who are the people that would get really good results based off of what you've seen? So whether it's like kids who aren't latching well, go ahead and tell us a little bit more about that.
So I meant, because we kind of talked about how we still do our traditional occupational therapy. So we still see those kids that have some kind of sensory concerns. They may have a diagnosis of autism or somewhere on the spectrum that, that they're struggling with things with that. We might see kids who are having handwriting difficulties, but then you think about the myofunctional cranial sacral part of it, that kind of ties into all of those things. Well, kids that are not eating well, kids that are not gaining weight, kids that are, having like some sensory aversions to different types of food. Those are also the kids that we see, and we can kind of combine that combine our traditional therapy with the myofunctional, the cranial sacral stuff as well. We see kids who've had, hydrocephalus. You see a lot of that. We see a lot of like torticollis babies. Those things. But then thinking about the other spectrum and the adult side. So people that are having chronic migraines, we started seeing that. You and I have talked about that. We have people who are just struggling with just like their braces are not fitting well and they're kind of having some tongue thrust issues. We have that problem as well. Let's see. I can't think of anything else.
Yeah.
Like, I feel like I've hit
probably
all of
something like sleep apnea too.
Sleep apnea is a big one. If you're not sleeping well at night, any kind of like airway issues, and maybe just the myofascial cranial sacral stuff is you're just tight. You're tight in that up in your chest and your trunk, and you're not breathing well. You're struggling to when you're working out. I mean, this is things that happen, like even with my oldest daughter. And that's why she's benefited from this, is just those type of things, like struggling to run a long distance during track practice, those type of things.
Love it. Well, Janda, thank you so much for coming on, and we're grateful to have you in the community.
Yes, thank you.
Thank you for all the work that you do.
Thank you. I appreciate you.
Absolutely.